Dr. Kumari from Periodontic Department. Today we are going to see aim, objective and scope of periodontics in general. And as such, we know about the children department. The periodontics is the child-defined specialty. Below 13 years, we are going to do all the treatment, the dental problem, diagnosis, management, and the treatment plan, and also the preventive care for all the children. So we are going to see today the aim of the objective and scope of periodontics, how it is proceeding with that. And today the topic is that, and what are the things we are going to see is introduction, definition, aim and objective of pediatric dental practice, history of periodontics, periodontics in India, and milestones of pediatric dentistry in United States, and challenges for pediatric dentistry in 21st century, and difference between a child and adult patient, responsibility of a periodontist, characteristics of an ideal periodontist, and future of periodontics, how it is going to proceed. Okay, so I think as we say, it is a periodontics. The word mentioned is pedo plus dontic. Pedo derived from Greek word pious, which means child, and dontics means the study of the tooth. So, study of a child tooth is periodontics. And as we say, the definition, there are lots of definitions are there. But when you just look at the American Academy of Pediatric Dentistry in 1999 is the standard goal setter, so which we have been following from that in the current year. So pediatric dentistry is an age-defined specialty that provides both primary and comprehensive preventive and therapeutic oral health care for infants, children through adolescents, including those with special health care needs. Mean that under below 13 years, we are doing all the treatment, all the procedure which we are doing in the adult cases. We are doing a diagnosis, management, and preventive care for the normal children as well as for the special children also. That's what the definition says. And the voucher also says branch of dentistry that includes having a child accept dentistry, prevention, detection, restoration of primary and permanent dentition, applying preventive measures for periodontal therapy, dental caries problems, intercepting and correcting various areas of malocclusion. But Stewart and Bay in 1982 says pediatric dentistry is the oral health care of a child from birth to adulthood. It is constructed to include care for special patients who demonstrate mental, physical, and emotional problems. And all the category which have been existing, all the management, diagnosis, and prevention of children below 13 years for the normal children as well as for the special health care, where the periodontist is playing a major role. And when you just see the aim of that, and to determine what is the best for the children to be given for by the periodontist, what is the best for the adult in whom the child will eventually grow. That is what the aim which the periodontist should focus. And objective is an overall health of a child patient should be seen to that. Not only the oral health, and oral health is good for general health also. So the well-being of general health also will be well taken care. And the motive is the periodontics and preventive dentistry, preventive treatment for the children, and prevention is always better than cure. So not only to save the patient, I think dental problem both physically and emotionally, but also maintain the overall well-being or general health also should be concentrated. Apart from that, comprehensive oral health care. What after 13 years we are doing it? We are doing everything under one roof. I think below 13 years for all the dental treatment is done here. That is a comprehensive oral health care. And the developing dentition, the child will be crossing from the primary dentition, mixed dentition, and permanent dentition. So the developing dentition is having a more important role. So all the dental problem, if you have been correcting during this period, monitoring properly, the dental problem in adult phase, that is a permanent dentition, will be avoided. And to do all that, I think periodontist should update his knowledge. I think he should know everything in the currently what is happening and the back history. And I should give you a quality of dental. With the clinical side or the academic or the research area should be well thorough with the pediatric dentistry. An objective as such, a psychologist as a periodontist is also a well trained, because a child patient cannot be managed by the normal children. So we have to come down to their level of the patient, and some children will be cooperating, some will be after having lots of time spent with them, communicating so many things and doing that. I think they'll oblige to sit in the dental chair for the dental treatment. So as a trained psychologist, we can say as a periodontist. To be a successful periodontist, one should have a scientific approach and a tremendous patient. Patient is very much needed. Dedicated work and handling with the tender and loving care to the child. I think apart from the normally we are treating, these all the characteristics the periodontist should possess. And when you look at the history in 1800 in ancient period, no caries in children teeth. But in 1563 and 64, and they have just started in categorizing in the both primary and the permanent dentition. The two names have come. And 1737, Geraldi says about the theory of tooth eruption and exfoliation. And 1763, Joseph Herlock published first book in dentistry. In 1764, Robert Coonan, father of periodontics, just say the importance of deciduous dentition. In 1926, a periodontic study club started by Samuel Harris, a father of children dentistry. In 1947, American Academy of Periodontics was founded. 1984, American Association of Pediatric Dentistry is renamed, and that is started existing. And 1920, in Calcutta, the first dental college started by Rafiuddin Ahmed, the part of dentistry in India. He also published first edition of Indian Journal in October 1925 and founder of IDA in 1927, passing of Dentistry Act in 1948. And periodontics in India, 1935, BDS is a license. The dental science became a Bachelor of Dental Surgery being established in 1930 college as a separate specialty in Amritsar. And 1979, and the father of periodontics India, Dr. B.R. Washer, been formed. In 1982, ISPPD, Indian Society of Pediatric and Preventive Dentistry, been affiliated to International Academy of for Dentistry for children. And when you look at the challenges, I think in 21st century, there are a lot of level and the sealants and water fluoridation, topical fluoridation, and home care measures are being should be well taken care. And infant oral health care should be concentrated. Acid technique and sealant and composite resin have been come up, and that should be well taught and learned by the practitioner and the student. Dentistry for the disabled patient and other children also with a special health care should be concentrated. And the sophistication of radiograph techniques and machineries have come. Infection control and sterilization methods have been started working. And child abuse and neglect is a concept which I think really have to, which all the people have to look into that. And earlier, I think there are so many organizations are available, and it will be dealt in a separate topic. So this is also be very, as a periodontist, we should concentrate on that. And child and adult patient has also been enumerated by the 4th century. And child is in no way related to the adult, I think, which we have to very much well taken care. And all the body size and the respiratory system and cardiovascular and emotional system all have been different. And when you look into the behavior of the child patient should be well assessed. The behavior management techniques in treating a child is more important when you're doing any procedure. And we have to consider the modified cavity design, radiographic consideration, endodontic and oral surgical consideration also to be taken care when comparatively adult. The extra attention to be given for the child patient. And when it is the periodontic treatment triangle, where the child and the dentist and the parent have a good rap, and all the three have to have the equal importance in the success of dental management, as well as the society also later it has been modified treatment triangle. A society also playing an important role. And a pediatric dentist and other specialty is different, and where there's have a young age to the adult, I think they've been traveling, and many dental problems been identified and have been I think treatment is done, so that lots of preventive care is taken. And oral health care of the child when messages overall health care also be maintained by the patient. And I think when you look at the patient, good judgment should be done while planning or executing any treatment. You have to do a proper diagnosis, and treatment should be performed according to the best of the ability of your periodontist should be given, and should be gently handle the children, and should be emphasized the preventive aspect also. You should have an idea about the preventive care and do the treatment accordingly. And when you look at the community also have the role, and you have to identify whatever the dental problem in the society, that is in the, I think children are the future concept. So whenever you are identifying some dental problem in children and eradicating, there are lots of sequence. I think many problems being avoided. The prevention is better than cure. So conducting many preventive program, educating the teachers and parents also should be done to eradicate all the dental problem in society. And we should be proud of our profession, and honest and finest services should be done how much ever it's possible. And the most increases the knowledge and practice should be there. An ideal periodontist should be self-coordinated with a positive mental attitude, and goal orientation should be there, and flexibility in managing the children should be there, and cheerful and gentle approach and tender loving care should be there when you're managing any child patient. Ortho-friendly approach should be there, and sincerity and honesty also should be. So the healthy oral health is very much important, and it's age-defined specialty. and the technique and disease-specific specialty. Professional and public recognition of will be there when you're managing a child patient, and the public sector regarding the child dental care. And while recognition of fluoride as a preventive care should be taken care so that this periodontist, because when you're managing with the children. And here the high-speed technology, the preparation of teeth, great improvement in various aesthetic agents, and introduction of sophisticated plastic composite ionomer conformer, fit and pressure sealant, and invisible filling, and radical changes to control virulent infections, recognition of a child as an individual, care of the patient for the normal children, and special care also given. And when you look into the present trend in pediatric, where we have to concentrate preventive and public health dentistry, child psychology and management, advanced restorative dentistry, preventive and interceptive orthodontics, special care dentistry, child abuse and neglect, and genetics in pediatrics is the current concept which been booming, and where we have to give lots of should be given. On the whole, when you just look into that, we have just made them. We have just looked into the aim and objective scope of that, and I think different approach how the periodontist role, and what are the preventive care should be taken, and history, what are the modern trends that are available, the importance of pediatric dentistry, and the difference between child and adult, and as well as pediatrics, how he has been different from other general dental practitioner, and also the periodontic treatment triangle. So these are the, I think, various concept. I think current trends available in periodontics is all should have been well discussed with that. And I think this periodontic is I think is a very important subject where we are dealing with children. That is a noble hand.